The following portion of Daytime is sponsored by Moffitt Cancer Center.
Surgery is a cornerstone in cancer treatment, and at Moffitt Cancer Center, patients are able to receive care from some of the top surgeons in the country. Here to tell us about the team of experts in the gastrointestinal oncology program is Dr. Daniel Anaya. Welcome, doctor. It's nice to meet you.
Thank you, and very nice to be here.
I know that you are the chair of the Department of Gastrointestinal Surgical Oncology and Gastroenterology. What types of cancers do you and your team treat, and why is surgery so important?
Right. So we treat any lesions, precancerous or cancers that originate in the GI tract, in the gastrointestinal tract. That includes esophagus, stomach, liver, gallbladder, pancreas, small bowel, appendix, colon, rectal, and anus. So everything in the GI tract. And surgery is critical because, with a few exceptions, it's really the only curative treatment for all of these cancers.
And so if someone is diagnosed with colon cancer, for example, or any gastrointestinal cancer, what is your recommendation? What should they do first?
Right. So I think it's key that they go and see a surgeon that specializes in that type of cancer. I think in cancer and in cancer treatment and in cancer surgery as a whole, you want to get the first treatment right, because that determines what happens in the future. So you want to go to a surgeon that specializes and does high volume of those procedures, because that correlates with having good results. You also want to be in a place that has a treatment approach using a team of different specialties that include not only surgery, but also medical oncology, radiation oncology, pathology, interventional radiology, and other treatments that are adjuvant to the treatment of surgery for patients with GI cancers.
And in your view, why is that place Moffitt? Does Moffitt have specific approaches to treatment that maybe other places don't?
Right. Well, Moffitt, number one, is an NCI comprehensive cancer center that ensures for patients that you get the highest quality of care using a coordinated approach with all the disciplines housed at Moffitt, number one. Number two, I think our surgeons are really experts in the field, and they work under a subspecialized framework. So if you have pancreas cancer, you will be treated by our pancreatic surgery group. If you have colon cancer, you will be treated by our colorectal surgery group. And we also work within the framework of a team of multiple disciplines. So everybody will review the case. Everybody will come with a consensus of what's best for you, for your cancer type, and for you as a whole. So I think all of those things put together really make things easier for patients and ensure that they get the best treatment possible. We're also definitely committed to making sure that patients have an easy access to Moffitt so that we can streamline the process of workup and treatment initiation as soon as possible.
How quickly can you see them?
We can see patients, for example, we have an initiative right now. Any patient that is diagnosed with colon cancer and calls to Moffitt, we have a promise that we will see them within the same week. Within the same week.
So how can someone go see you at Moffitt? Do they need a referral, or can they just call?
No referral is needed. That's one way, but no referral is needed. We recommend they go to the Moffitt website, moffitt.org, and they can really research about their cancer and contact the Access Center, and we'll be able to schedule an appointment with the right provider.
That's wonderful, doctor. Thank you so much for sharing your time and your expertise with us.
Thank you for having me and the opportunity of sharing this with our community.
It's our pleasure. Thanks
Thank
again.
you so much.
If you would like more information, be sure to visit moffitt.org/outcomes. Daytime will be right back.
The preceding portion of Daytime was sponsored by Moffitt Cancer Center.